Good morrow, DPT1 class and Dr. Gorman, excuse me, sorry, my teleprompter seems to be malfunctioning. How are we doing today on another beautiful day of tuberculosis news? We're going to start it off by giving you a quick, swift definition before we move on to some of my colleagues. Tuberculosis, also known as consumption, is an infectious inflammatory systemic disease that affects the lungs and may also disperse to involve lymph nodes and other organs. TB is caused by infection with Mycobacterium tuberculosis, also known as Tuberculosis, characterized by granulomas, caseous, necrosis, and also cavity formation. The body is sometimes capable of completely eradicating the disease through normal immune defenses, although other times it will cause a primary tuberculosis infection. TB can either be primary or secondary. Primary infection is usually asymptomatic and almost always, in 99% of cases, remains quiet. Primary infection usually involves middle or lower lung areas with lesions consisting of exudation in the lung parenchyma. These lesions become caseous, diseased tissue that becomes dry and firm and actually has the visual appearance of cheese, and can spread to the hilum, which allows the infection to gain access to the bloodstream and predispose the person to chronic and extrapulmonary tuberculosis at a later time. Secondary tuberculosis develops as a result of either endogenous or exogenous reinfection by the tuberculous, the bacteria that caused the primary tuberculosis. Reactivation of TB usually causes symptoms in the upper lobes of one or both lungs. Most commonly, secondary tuberculosis is almost always the result of endogenous reinfection when the primary lesion becomes active. Each year, 2 billion people are latently affected worldwide, and 2 million deaths annually from active tuberculosis occur. We're going to now meander on over to my colleague, Medical Mike, with the causes.
Hi, this is Medical Mike here, reporting for the causes. First cause, the agent is Tuberculosis, which is transmitted by inhalation of airborne particles. This is done through sneezing and coughing, so watch out in the local Chuck E. Cheese's. They're pretty bad with the kids coughing and sneezing, alright guys? Tuberculosis is transmitted through prolonged exposure, not through quick stuff, guys. This is prolonged. This bacteria has some great endurance. It can last for a couple months up in the sputum. That's a great thing to have, this endurance.
Medical Mike, thank you very much for that interesting and uniquely accented report on the causes. Next, we're going to go to TB Tyler with the signs and symptoms. Other signs.
Oh, okay. Sadly, the signs and symptoms for TB don't usually present early, which is the most curable stage of the disease. Usually, it takes up to a year for you to be able to detect the bacilli, and it's only through a positive skin test. Common symptoms include productive cough of greater than 3 weeks in duration, weight loss, fever, malaise, night sweats, fatigue, and anorexia. Upon lung auscultation, one may hear rales in the area of lung involvement, which sounds something like this. Also, one may hear bronchial breath sounds if lung consolidation is present, which sounds a little something like this.
Thank you, Tyler, for that incredibly accurate representation of auscultation sounds. Next, we're going to go on over to Disease Davis for risk factors.
Yo, what's up guys? It's your boy Disease Davis. We're back at it again with the risk factors, this time for TB. So risk factors for TB include people who work or reside with people who are in high risk for TB in facilities or institutions such as hospitals, laboratories, homeless shelters, correctional facilities, nursing homes, for those with HIV or age of 65 years or older. Inhaling air-lit droplets or infectious aerosols that can be found when dealing with cadavers of all things. Are we insured? I don't know. That is why there needs to be adequate ventilation, most important measure to reduce the infectiousness of the environment. Not just the air conditioners can do, people in a cadaver lab, all right? Homeless people living in overcrowded conditions, frequently ethnic groups such as Hispanics, Native Americans, and Asian Pacific Islanders. That's why I'm talking over here, baby. So and then also immigrants from Southeast Asia, Africa, which has a high HIV incidence, and Eastern Europe and Mexico also have an increased risk factor for TB. Clients dependent on injection drugs, alcohol, or other drugs associated with malnutrition, debilitation, and poor health also have a high risk factor for disease. Lastly, people with medical conditions that weaken the immune system, like I said, HIV, malnourished, organ transplant recipients, cancer chemotherapy, or prolonged corticosteroid therapy can increase as well for TB. And finally, but not least, women who are pregnant.
Disease Davis, always a pleasure. Next, we're going to talk about some medical management with, excuse me. Hello? Okay. So I'm getting word that Medical Mike has actually just been hospitalized with tuberculosis that he recently acquired from a visit with his family to Chuck E. Cheese. Interesting. So now filling in for Medical Mike is Mike. So on to Mike for medical management.
This is Mike here, giving you the medical management. First we have is prevention. For preventing tuberculosis, we do TB screening, especially on immigrants and children. This is really important to keep this disease controlled. And another way we do this is by room ventilation and overcrowded areas. Lastly, cover your mouth and nose when coughing and sneezing. Humans are not tissues. Now we got the diagnosis of tuberculosis. First we have is physical examination. Next we have is tuberculin skin test. This is positive if the skin is swelling and hardness at the site. We have chest radiograph is another way we determine if someone has TB. Microscopic examination and culture of the sputum is the last two ways for diagnosis. For treatments of TB, the primary treatment is done pharmacologically. Also, that can be done through chemotherapy is another term of use. Lastly, for prognosis, untreated TB is 50 to 80% fatal and 2.5 years on average until death.
Mike, thanks for the report on short notice with the current condition of Medical Mike. It was nice of you to step in. Next, we're going to go to Tay Thurnpiece talking about the PT implications.
So, before we talk about PT interventions, we have to talk about PPE. So, for a person with tuberculosis, you're going to want to have them in a negative pressure room, which keeps the germs on the inside. And you're going to want PPE, such as sterile gloves. So now before you have contact with the patient, you need to wash your hands. Remember to sing the ABCs as slowly as possible to make sure you wash your hands for as long as possible. Next, airway clearance techniques such as postural drainage. The next airway clearance technique we're going to do is huff-cough training. A huff cough looks like this. Are you watching? Your turn. That was great. Exercising while you have TB will improve functional outcomes.
Wait, no, it doesn't.
It doesn't?
No.
Exercising after you have TB will improve functional outcomes, oxygen uptake, and dyspnea.
That's true.
All right, folks, so that's all we have today on Tuberculosis News. Thank you for joining us. And remember, if you forgot anything about today's report, we'll probably learn it in ortho.